In relation to tracing and testing, just wondering who is responsible for managing the positive tests and who for the negative tests. So in relation to some information brought in by Deputy Naughton during the week with respect to meat factories, we've had contacts going out to management in meat factories, not going direct to the patients, to say that patients were tested positive. And on the other hand, we've had negative test results which have been more than a couple of weeks coming back. So there's significant issues there which you might address, please. The other thing, in relation to the private hospital situation, 45% of our population have private health insurance and at the moment are being excluded from accessing their general consultants' work and any opportunity to have treatment. Could I ask you just in terms of, you said that a significant number of doctors have signed up to the Type A contract. I'd ask you how many surgeons have signed up to the Type A contract. Would be my understanding in the private hospitals where a lot of elective work is done. If you don't have a surgeon to do it, it's not much point having the other consultant staff on board. Just beyond that too, with respect to the hospital contract, we have 115 million going out per month for securing that. I see from data of the 18th of May, only 30% of the beds in the private hospitals were taken up. I would say these are not patients. Many are long-stay patients from the public hospitals which have been moved out. So I think the NTPF annual budget is about 30 to 50 million euro per year, and we're spending 115 million. I would like to see that contract revised, certainly. Just in relation then to UHW, can I put something on the record which is not quite COVID related but is as a fact of it? We had a diagnostic cardiac diagnostic lab facility on site there since September 2017, which was moved off the premises in the last couple of weeks. The contract was not extended. We're now back to one cardiac cath lab in the southeast for the 500,000 people. We have a hospital with 160 beds. Sorry, Chair. No, it is related to COVID, Chair.
COVID response?
Yes, I understand. I just make the point. I'll just make the point, if I may, Chair. We have 160 beds in the hospital. We have only 3 patients in there presently for COVID. So I would just ask you to reflect on that. And just in terms of the CMO, can I ask you, CMO, in relation to ongoing treatment, is there any update on hydroxychloroquine, the idea of using vitamins, particularly vitamin D, to supplement the elderly, and zinc? And also your thoughts on antibody testing. Can this be used at any point in the future? And the other one point I'd make with respect to all of having the lowest incidence of COVID in the country, why can the regions not be allowed to open in advance of the major population centres? Thank you.
Thanks. I just remind witnesses that are only asked to answer questions in relation to COVID. Response.
The positive test, Tony can confirm this. The procedure is contact tracing would take place with the individual. So I'm not aware or can't understand what the issue that has arisen with an employer getting a result in the absence of
it's been communicated to your department.
But I can't talk to you about the policy, which is that it would go back to that individual who has been the subject to the test. There have, as Tony has referred to, there have been delays with negative tests. Probably a negative test is the one that's less concerning to the contact tracer, but as Tony has outlined, we've now automated that, so that will flow very readily. 97% will go back with a text message. In relation to the private hospitals, I wouldn't agree that 45% of people have been excluded. The private hospitals are open to the whole community at this stage. It's a clinical judgment as to who gets admitted, and that won't be decided based on somebody's insurance, but that equally means if somebody is insured and they're clinically necessary to be admitted, then they're eligible for admission. In relation to the number of surgeons, I don't have the exact number, but I wouldn't expect that there is the type of huge bias that you're inferring. Surgeons need hospitals. And so they would want to, in order to practice, they would want to have access to private hospitals. There are some other specialties that don't need hospitals as much. They can do a lot of their work in an outpatient setting, and they may be less represented in the numbers that have signed up. But we haven't experienced a major problem in terms of surgeons different to other doctors. We've had some delay in everybody signing up, but not specific to surgeons. I might leave Tony to comment on the others. I wasn't going to comment on the cath lab, but I do know the full extent of the concern and the issues and all of the work that has gone in both by the HSE and nationally on it. So
just it's just time for Dr. Holden.
Just to be clear, yes, I mean, we have had some reports. The microphone, I think, is on, not on again.
Yes, it's on.
Some reports of employers receiving results in respect of individual patients. That's a breach of confidentiality.
Okay,
full stop.
Thank you.